After terrific national picture, I want to turn us back to the state of California. And I want to say we need to be extraordinarily audacious. Despite some of the national necessary distractions we need to deal with, the lives and well-being of Californians depend on our actions. We know what to do. We've had enormous success and in many cases leadership in California, and we just can't stop. Recently, having coffee, one of my favorite things to do, I met someone and she asked me what I did. She hadn't heard of Prevention Institute. And when I described what I did, she started to cry. Nobody cries about prevention. But she was crying because she was a physician, had just told someone at San Francisco General Hospital that he had diabetes, that it was very severe. Encouraged him, of course, to take his medicines, which she prescribed for him. Also encouraged him to take better care of himself, including walking when he got home from work every night or some other kind of activity, buying healthier, fresher food, and said to me, and when he closed the door, I felt like a hypocrite because I knew where he worked, how late he got home at night, and it wasn't safe to walk in that community. There was nowhere nearby available to buy healthy food. I felt like a hypocrite, she said. I felt powerless. And the point is that she was confusing health and health care and thought the only thing she could do, though she saw the bigger picture, was the medical side, and didn't recognize how much we need to focus on community determinants of health, that we all have a role in that, and that, as I say, we need to be audacious about the role. So at the same time, we need to pay attention to medical services. We need to pay attention to prevention. But there's not a lot of buildings in this state or anywhere that say prevention on them. So we need to focus on that more so. Most importantly, as one of my mentors, George Albee, put it, because no epidemic has ever been resolved by paying attention to the treatment of the affected individual. We can solve our health and well-being problems after people get sick or injured, and we can't solve them one person at a time. So our prevention focus then needs to go beyond needs to go beyond brochures. Sometimes it takes a while to figure that out. And it means really paying attention to systems. And one of my favorite systems is a radio, because you got all these pieces of metal, and somehow when you put them together the right way, and I think we're seeing the same thing now with computers, all of a sudden you've got sound, or you've got intelligence, or there's all this capacity. And so it's time for us to think about systems of prevention. And by systems of prevention, what I want to cover today is the notion that the environment is critical, that we need to have a laser focus on health equity. We really need to engage healthcare not the way that physicians saw it, but healthcare in partnership with community. And we're talking, despite the fact that very few people seem to have implemented this very well, about physical and mental health being part of our healthcare. We certainly have got to talk about sustainable funding and finally making the prevention formulas work so we can save lives in the first place. And perhaps most importantly, we have a lot to build on. We know that prevention works. California has been one of the leaders, and one of the ways we achieve success is through norms change. So starting with the environment, we all get the environment when we think about the air, the water, the soil, the asthma monitor, and its impact on illness and injury. But equally, we need to understand how the environment shapes our behaviors, mostly through norms, and how that too has that kind of impact. So given it's middle of the morning, I thought we should play my favorite game, What's Health Got to Do with It, and identify not only the stupidity of the pictures I'm about to show you, but the fact that they're actually shaping our health. So what diseases or illnesses or injuries do you see there being created by this kind of thinking? Clearly diabetes, hypertension, and so forth. I'll answer since it's such a large, shy room. And when I took this photo in San Leandro, I hoped that the owner of that Wendy's was a really, positive guy who was just a bit confused until I showed this photo and someone from Indianapolis said, I saw the same thing in Wendy's here, and I realized it was a heartless corporate strategy to make money under the guise of doing good. This is Atlanta, near the Centers for Disease Control and Prevention. Are we creating illnesses and injuries by this approach to the environment? Can you name which ones? The point is, as the Institute of Medicine put it, it's unreasonable to expect that people will change their behavior easily when so many forces in the social, cultural, and physical environment conspire against such change. This is the Institute of Medicine. Use this. This is our national expertise. It's unreasonable to expect people to change their behavior. We're not just going to give them information. It's the forces in the environment that conspire. And so we need to focus, laser focus on those forces. A playground in New York City. Somebody thought this was a cute gateway. Are we actually, through norms, affecting the health and well-being of our young people when this is the kind of environment we create? So we have to ask not only what's health got to do with it, but what's health and equity got to do with it. Here's an example I took on a highway in Richmond, California. Can you name some of the illnesses and injuries that this creates? Violence against women, alcohol, drunk driving, injury, car crashes, probably a number of others as well. And so Tony Iton, from now at the California Endowment, when he was our health director in Alameda County, showed that an African-American child living in Oakland's flatlands will die on average 15 years before a Caucasian child in the not super wealthy but wealthier Oakland Hills. The same kind of study in LA, a 12-year difference in life expectancy. Similarly in Fresno, so the health inequities we see are not just individual bad choices, but as Nancy Krieger put it, and as was affirmed by Alonzo Plow, they're about things not being fair. So what I really want to talk about, though, is not the problems. I want to talk about the strategy and what we can do strategically, starting with the spectrum of prevention, which is our signature tool for saying we need to work on multiple levels at the same time. There needs to be synergy, and the higher levels, organizational practice, policy, and legislation, are wider because they have a bigger impact, and we can't just do information and brochures, and we can't just do the more easily proven clinical prevention. We need to change the environment through community determinants. One of my favorite examples of this, a billboard put together by California Endowment, which not just shows the discrepancy in zip codes, but has the policies as of that particular year on the side, and said, here's what you can do to create policy change. And the most brilliant thing is that they put these particularly where legislators would see them going home on the weekends. This is a photo at Sacramento Airport, perhaps the best place to put a billboard like this. Another part of strategy, which my opening hinted is critical, is we need to transform the health system so it's not just about accessible quality care, but also about quality prevention. One of my favorite examples of that is right near our office at Asian Health Services, where sadly there was someone hit by a car in a crosswalk and he died. And so they said, we've got to do something about it. They looked around the neighborhood. They saw incredible population density. The crowdeder it gets, the more people are rushing. I drive through there. I got to make a right turn. I'm getting frustrated. I'm looking to the left as the cars are coming. I quickly move to the right. There's all these people crossing the street I forgot about. We got to fix those kinds of problems. And so they brought together community members, they brought together neighbors, they brought together all the key partners. I love the metaphor of a jigsaw puzzle, and we have a tool collaboration multiplier for multisectoral collaboration because the pieces together make even more sense than they do individually. And this is the solution they came up with. First, the cars go in one direction, then the cars go in the other, then all the cars stop so we don't have that conflict between cars and pedestrians. And the Safe Trek Traffic Safety Center at UC Berkeley showed there's been over a 60% reduction in dangerous car pedestrian interactions. And that's part of what we translate social determinants to be about, community determinants. It relates to the look, the feel, the safety. It relates to getting around. Another example, because I'm trying to bring the four elements of the panel together, is about data. And at Cincinnati Children's Hospital, how again using asthma variation, they talked about data, and they were able to pinpoint where the high asthma hotspots were. They were in particular housing owned by particular slumlords. When the newspaper in Cincinnati picked it up, it led to significant improvement with some legal pressure behind it, saving lives, helping kids breathe, the community determinants of housing, air, water, soil. We see these elements as part of the broader elements of community health that we've carefully studied to say what are the links between social determinants and how they play out in the community and behaviors and medical conditions, so we can track back from the leading causes of death, of illness, of injury, of inequity, and of cost, and we can show where the community prevention strategies are. And as I said, somehow we seem to cut off health between the head and the body, and it's time to build much more interaction and interface between physical, mental, and behavioral health. And we're looking at those same community determinants as the way to do that. Sustainability is another issue, and Jen is going to cover it thoroughly, but I wanted to mention a few points. In work we did here in California, and then in partnership with Trust for America's Health, we predicted that a $10 per person community investment in chronic disease prevention would save $5.60 for every dollar invested within 5 years, a $16 billion return of investment to taxpayers. And that was one of the tools that led to prevention, community prevention, being part of the Affordable Care Act. We've still got our replacement for community transformation grants now with Pitch, with REACH. We need to fight to maintain those at the same time that we fight to maintain health care. But this was an assertion Recently, CDC went back and looked at the ARA, Community Putting Prevention to Work, community partnership grants that even preceded the community transformation grants, and said if these were to continue for 10 years, we would see more than a 5-to-1 return on investment. So a little longer than we predicted, but it was a prototype, but clearly tremendous savings if we wisely invest in prevention at the same time that we save lives. So we call this closing the loop. How do we use some of our expenditures and some of our taxes, and then how do we capture our savings and not just see them support health care, but get reinvested in prevention? And so much of the way we've measured return on investment has been for one business or one sector at a time. When we raise it and we say, what about the additional benefits to other sectors? What about the additional benefits to the community? And moreover, what about for us, what we really care about is our health and well-being? We show much more return on investment. So the final thing I want to say is prevention works in California. And it's really about norms. And I want to very quickly show you a series of norms changes and how we've achieved success. Remember this, some of you, when doctors and even dentists supported prevention. Now we have people out on the ledge. That's the third smoker we've lost this week. And we say, wait a minute, he's smoking too close to the ledge. We can't allow that. But more seriously, tremendous drop. We've got about a third of the smokers we did when I and others were engaged in the first no smoking laws. We've got pharmacies banning tobacco starting here in California. And then when we look at soda and unhealthy food, and I remember when this Newsweek article came out, 6 million kids are seriously overweight, what families can do, and our reaction as a state. 6 million kids, and you're asking what families one at a time can do? It's a question of bringing together partners and reframing the nutrition and physical activity debate from simply a matter of individual choice to corporate and government. And this was part of the steering committee that made this happen, and as many of you know, the Governor Schwarzenegger signed a number of bills in LA. There was a parks assessment because parks and playgrounds are a key part of physical activity. This was one of the first places when the governor signed the bill saying we need healthy drinking water in every school. And now we're seeing the results also from the Berkeley soda tax. This we haven't quite achieved yet, but this is one day on an LA freeway a few years ago, and now we're seeing efforts across the state like Vision Zero. Another positive change, here's this picture. Somebody stepped in and repainted the sign. So as we go through norms change, we need to move from emergency rooms to emergency rooms and prevention efforts. We need to do it together. What I've learned about norms change, very relevant on a warm California day, is it's like a snowball. It starts out slowly. We say, are we making any progress? And like we've seen with tobacco or with healthy eating or soon with tons and tons of soda taxes, it's going to grow and grow and grow. And as Albert Einstein put it, intellectuals solve problems, but geniuses prevent them. And this is a wonderful quote, and I like him because of his hair. And, but it's only part of the solution, and the other part is we've really got to work together to build a movement. We're seeing tremendous voices. That was the question I wanted to ask to the last question. How do we engage those voices, not only about health care, about prevention? We need a movement for a new norm and North Star, a system of prevention and equity. Thank you all very much. I hope this was helpful.